welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton. And I just wanted to remind you that I am available to help support and educate and empower you on my Instagram and Facebook at Brayton Birth Method. And today's episode is really time relevant because I had the honor of interviewing Dr. Shakha Gillin, pediatrician out in San Diego, to speak on the coronavirus and specifically how it's impacting our children and also how it's impacting our emotional well-being as parents. Shakha Gillin, MD, has been in North County since 1990. She attended UCSD for her undergraduate education and for medical school, and then did her residency at UC Irvine and was chief resident at Miller's Children's Hospital in Long Beach. She practiced pediatrics in Jolla for 5 years and Encinitas for 5 years. She has also worked at a private practice in Newport Beach and at the Rady Children's Hospital Emergency Department. Dr. Gillin has a special interest in preventive care, particularly healthy and active lifestyles for children. She was recognized by San Diego Magazine as the top doctor annually in the rankings for 2006 through 2018 and was recognized as best pediatrician by Ranch and Coast. She was the founder of the North County Pediatric Journal Club and is the Francis Parker Board Trustee. She's a contributing author for AAP, healthychildren.org, and CrossFit.com. She lives in Del Mar with her husband, Scott, a pediatric anesthesiologist, and their son, Taj. Her twin sister is a dermatologist in Encinitas, and in her spare time, she enjoys exercising and shopping. And I'm just really grateful that she was also coming on to represent the product Active, where you can get 20% off using the code WellAdjustedMama. It is an amazing product to help keep our skin and microbiome healthy and clean. Hi, Dr. Shakha. Welcome to the show. I'm so happy to have you on today.
Hi, it's a pleasure to be here.
Yes. So we are actually, I'm excited we connected a couple months ago, and we were going to talk about raising healthy kids and how, prevention and wellness and active lifestyle are crucial for keeping children healthy. And I know we're going to cover that as well, but we're going to kind of switch gears and really go to a topic that's really on top of mind for everyone listening right now. And that's about the coronavirus and really how we can, as parents, support our children at the physical, mental, emotional, spiritual level and staying healthy and strong, and how to really manage the pressures that we're all feeling right now.
Yeah, I definitely agree. And I still want to talk about the other topics because they're so important right now while the kids are all home, the families are together. There's so many opportunities to really dive into there. And I know it's a hard time to say that's an opportunity, but it really is. So I think COVID is on everybody's mind. The fortunate thing as a pediatrician is that our kids are all right. The kids are doing very, very well. And so that's one less stress we have of all the things going on in our world today. The thing that we can just remind ourselves as mamas and as families is that our children are fine. That we're not seeing any serious illness in the kids. The kids are getting it. The kids get COVID-19 and they spread it and they pass it on. But and they're the vectors, which is important in some of the stuff we'll talk about. But they are healthy. They're having mild illness. And so that's at least the biggest relief out of all of this.
Mm-hmm. Yeah, I think that's important for parents to hear and recognize. So let's back up and just start a little bit telling the audience a little bit about who you are and how you got into, your passion for prevention and wellness for children.
I have been a pediatrician for 20 years. I have a 15-year-old myself. So I went to medical school at UCSD and then went to residency. I did undergrad and medical school at UCSD and then did my residency at UC Irvine. Then I was a chief resident there and then started practicing in San Diego. And so I practiced in a couple practices and then about closer to 10 years ago started private practice and have been practicing pediatrics here in San Diego in private practice. And, really through the years as a pediatrician, I've just kind of found what is really important to me, and that's helping families find the best practice of parenting for them. And also through having a child myself, a 15-year-old, to see really what's out there. And I think it's pretty really kind of common for people to start over the last like 5-10 years to go away from the just things that are so toxic in our environment, right? And one of the big ways it started for me was really through food and to see what our kids are eating. And I have been nothing but overwhelmed with how awful, how some of the foods are just completely toxic, and we give them to kids as if that's something that belongs in anybody's body, and it's not. And that's sort of where my interests, my passions started, with really helping families do everything they can to parent proactively and making the best decisions.
Yeah, that is a big thing that we educate here in our office too, is just really like basic nutrition, and how there's a lot of like lack of awareness of what that really means and how to feed our families in the most healthy way. Like one thing that comes up a lot in my office with introducing solids is really how to do that in the best way and all of that. And there's a lot of misinformation out there, even coming from the pediatrician offices. So I think that's great that you're really, leading the way there.
You're totally right, though, too, like even coming from the pediatrician's offices, because, when I started practicing, I did exactly what the American Academy of Pediatrics told me, which was start with rice cereal. Now, even they, like, we all make changes and we all learn, and we all, we learn, right? And so I'm not faulting them because I was listening to that, but they've changed over the years as well. And so have I. And giving something that's out of a box as a first food. I love that you said that about first foods, because why in the world, it's like a perfect example. Why in the world would we give something coming from a factory into a box as our children's first food?
Correct.
It makes absolutely no sense, right?
Yeah, it's illogical.
So that's really kind of like where it all started for me. And then just helping, it's really important for us because we need to be that voice of reason with families that, look, I know that everybody's eating, crackers, but the kids don't need crackers. They don't need crackers. There's no nutrition. There's no growing anything of any value in a cracker for a kid. And so just because everybody's doing it doesn't mean that we need to do that. And I need to be there to help my families to say, hey, instead of that, let's get some vegetables. Let's get some nuts. Let's get some foods that have some nutritional content to it that help your kids grow.
That's right. Yeah, it's so important. So as parents are like, even though you mentioned already earlier, children are overall, being, they're safe during this pandemic that's going on. In general, parents are looking at how can I best support my child's immune system? What would some tips be beyond like the nutrition component you just mentioned?
Well, yeah, the nutrition's huge though. It is a really big deal. And I just have to go on a fun side note on that one is that, listen, we got the kids home, and there are things, I take this as like the perfect opportunity right now. I think that what I've been seeing in the office is a little bit more calm now. I think we're not quite there yet, but we'll get there, where families go, okay, we've got this. We're getting into a little bit of a new norm for a couple weeks, and we'll get there. But in that, ask yourself, what things would you like to adjust or make some changes? And in the nutrition, let's start with not having some of, when you go to the grocery store, which we've all been going to, it's like, don't get the stuff that they don't need. Get the foods that they want. Help our families and have the kids involved with the cooking right now, right? So to keeping them healthy is letting them understand where the food comes from and how we make it. And they really get a lot more enjoyment out of eating it if they're part of the process. And so it's a really good opportunity to have the kids eat healthy. And by eat healthy, for me, it comes down to two things: limit the processed foods and limit the sugar. And I understand if you're not in that place to have stocked up on vegetables or fruits, and by no means would I add more stress to that. But if you have it, then that's the choice you should make.
Yeah, and I think that's a great point. If you are at home, you can take the opportunity to clean out your pantry and get rid of the junk.
Absolutely. Or at least not buy anymore right now. Like when we're frantically, I mean, I was at the store last week and I went by the cracker chip aisle and I'm like, well, what maybe I need? I'm like, you know what? What am I doing? I haven't bought crackers or chips in years. Like, why would I want that? It was just, part of the whole, like, emotions at the time. And so just don't buy anymore. That's the easiest way, is just stop buying it. It'll go away. And like you said, toss it. The other part is sleep. It's really important for them to get a good amount of sleep. And our kids can get a good 10 hours plus, depending on their age. Routine is also a part of their health and structure. When times have been really changing, everything that we know as routine and structure has been taken away from us over the last couple of days. And with that, I think it's important to establish new routines and new structures. And kids really like that. And they like being a part of it too. So, I always ask my parents you may already know what you want for the day, but sit down with them at dinner and say, hey, you guys, what do you think would be a great tomorrow? What do you think we should do with the structure? What do you think we should put in there? And let them come up with the ideas. And then it'll be exactly what you wanted in the first place. But it makes them involved, and then they're really excited when they get to do those activities that that they suggested.
Yeah, that makes a lot of sense. Kids, even, I have a 2.5-year-old, and he even wants to, he has his own ideas of what he wants. And it's really important to respect that, right? It's not like a dictatorship.
Exactly. And Laura, do you have a 2.5-year-old? And is that the only?
Yes, that's it.
How sweet. So that must be really fun right now.
It is. It's a lot of fun. It's really hard work at times, but it's really a lot of fun and a lot of joy at the same time.
So that's so fun. So about being healthy then is that, like I said, the kids are doing all right. Kids are getting coronavirus, but we're not hospitalizing them. They're doing really well. So part of that, though, is that they're vectors. They do get the illness and they spread it to everybody. And so one of the things that we've talked about is how to keep them from continuing to spread virus all over the place. And I think that everybody at this point should know that we need to wash our hands, right? And it's a good time to teach them how to wash hands, because the majority of people just kind of stick a couple fingers under the water and move on. And it's such a life skill to know how to wash your hands. But we've gotten so busy, we don't even have time to actually do that. So teach them how to wash their hands. We all have hand sanitizer. And hand sanitizer is awesome, and you'll hear it everywhere, and it kills coronavirus, but it is also damaging to skin. And I'll point out the other obvious, which is it's not available anywhere. And so I think that people have asked me, so like, what else do I use? What other natural products do I use? And that's where we have spoken about active, which is hypochlorous, which is a naturally occurring ingredient that your body already makes. And what I do for my family and myself is, I will always wash my hands. I will use a little bit of hand sanitizer, but then I am spraying active all over the place. So that's after, when I come in the house, the first thing I ask everyone in our house to do is to, for us, I'm a physician, of course, and so is my husband. And so we immediately go shower. But for my son, he wash his hands, so anytime anyone's outside, when they come in, just wash their hands. And then inside after that, I'll be spraying active on the hands, even on the face. Kids, your 2-year-old is probably just, hands are everywhere. Hands are on the face. We've told everyone to not put their hands on their face, but 2-year-olds don't listen to that. They are just everywhere. I've had a lot of questions too. Like, people are like, so what if my 2-year-old is healthy? Can they, I'm like, they can't do anything, because 2-year-olds, the first sign of being unhealthy is when they sneeze all over your face. Like, that's how you knew, is they just coughed or sneezed on you and you're like, oh, that he's got something. So I think that, the active is a really great option for 2 reasons. One is it doesn't harm the skin because it's already a naturally occurring ingredient of your skin. And the second thing is actually available until Dr. Laura after your podcast, at which point no one will be able to get it since they'll all buy it. That'll be off the shelves too, right? So that's what I do. I do a combination of hand washing, hand sanitizer, and when I do the hand sanitizer, I just do just a teeny little bit, and then active as an active. It is definitely, it's safe on the face, it's safe on the hands, and the active ingredient hypochlorous works to kill viruses. But it also, because it's not toxic and because it's natural, there is a certain level of emotional anxiety that people are having right now. And active plays in really well to that because you could just spray away and spray away and spray away. I've seen kids in the office before that have their hands are just all red and dried up from hand sanitizer. And parents will say, well, my babies, can I put it on their hands? Because then they eat their hands. And I think especially right now with so much anxiety, and it's like you can't even touch a doorknob or anybody or anything, and packages and food, and it's so much that active just combats that, where you're like, okay, just spray some more on because your hands aren't going to get dried up or anything. They're just going to heal. So I think that it's nice to know that you can just spray away with that.
It works on viruses and bacteria, correct?
Bacteria, absolutely.
Yeah. And the other thing that I love about it is, like you mentioned, it doesn't have the alcohol that's drying. And the other issue with hand sanitizer is how it's disrupting the microbiome of our body. And a product like Active is not.
Absolutely. And
so important.
So I'm not going to, there's no specific relation to the active, but just talking about the microbiome is such a big deal. But also with antibiotics and bacteria is, there's nothing conclusive yet. If we knew, we wouldn't be here right now. But everyone's looking at, what's going on in Italy right now, what's going on in Italy. And one of the things that has been suggested, one of the things of many, is some possible, antibiotic resistance going on because so much antibiotics have been used in certain communities. And so it just goes to show, I'm not making a huge jump and saying that's the reason, but I am saying that we all need to be mindful about, combating bacteria, keeping your microbiome healthy without antibiotics.
Mm-hmm. Yes. And can you talk a little bit more about what the microbiome is and why it's important for our immune system?
Yeah, it's definitely one that I'm not going to go too deep into because it's such a huge conversation. It's an entire science in itself. So I will tell you a little bit is that, the microbiome is the bacteria that normally live in us and on us. And one of the big ways that we'll see is the gut microbiome. And in the gut, we have bacteria that normally colonize our gut. And they colonize before you're born, when you're born, during that first time period, the neonatal time period. And it basically establishes, there's just a lot of things that the bacteria do. And when you alter that with things like antibiotics, and by all means, antibiotics are life-saving at times. They have nothing to do with COVID, by the way, but they are life-saving for certain things like meningitis. But having said that, when you take antibiotics, it disrupts the natural microbiome. And so you definitely want to keep the normal bacteria there. You want to keep the good bacteria there, and you want to keep the bad bacteria out. And that goes into what you're probably, I think our conversation was before with the hand sanitizer, and you want to be able to keep certain, bacteria there and other bacteria not. But active plays a good role in killing the bad bacteria.
And not killing the good bacteria.
Yeah, without having to do oral antibiotics, which is important because you don't want to throw those oral antibiotics into your gut and then get rid of the good bacteria.
Right, exactly. And hand sanitizer does the same thing. It's killing all bacteria on our hands. It's, and not differentiating.
Absolutely. But, Active is good because it does kill the bad bacteria. It does. And it kills viruses. You know, we have to have a balance between just the what we're supposed to have, and our guts are all supposed to have certain bacteria, right? I think that there's a lot more to learn about the microbiome, and I think that's what's going to lead us in the next 10 years as to which gut which probiotics, which bacteria that are already there. That's a whole field of medicine that we're just getting into, and you'll probably have some good opinions on, is it lactobacillus GG that you prefer? Is it reuteri? And we're really seeing that there's so many different places for all of them.
Mm-hmm. There really is. And there's like even genetic components of what strains of bacteria are best for our physiology, which makes sense why the birth canal is so important for us to get inoculated, right, for our gut microbiome.
I love that, right? It's a part of the process that it's good for them.
Yeah, it's really important. So yeah, it's important for parents to think about, when an antibiotic is prescribed for their child or for themselves, to really, discern whether this is necessary, I guess, or not, right? And maybe working with a pediatrician who is not overly prescribing antibiotics.
Absolutely. We've seen such a change in medicine too. Like, 10 years ago, we used to do antibiotics for almost all ear infections. And now I 100% will observe in most cases and not do antibiotics. And it's remarkable how many ear infections go away by themselves without needing any antibiotics. It's actually lovely to see the body heal itself.
Yeah. Yeah, I see that as well. Children getting chiropractic adjustments to help the ear canal drain. And it's the body has the ability to heal itself, right? And we need to sometimes give it, I think, more faith and trust in its ability.
Absolutely. But it's a good direction we've gone in terms of, especially for kids, they just get, back in the day, you take your child to the pediatrician and they get antibiotics and they go, and it's a lot. It was a lot harder to explain to people why we aren't giving any medicine because their bodies can heal. But it's actually gotten so much better. People really get it. They really get it when they come
and appreciate it. I'm sure. Like, they're like, oh, I don't want to just put another drug into my child's body.
Absolutely. And I have to give a lot of credit to the parents because a lot of times it'll take extra time for them where they have to come back into the office and just make sure that it's not getting worse. And, we do this observation and we see them back 2 to 3 days later. And just kudos to the parents who go, you know what, I'm okay with that. I'm going to watch it and I'm going to come back in a couple days and just to make sure we did the right thing. And I love them for doing that.
Right. So it's once again, just, recognizing we're not looking for a quick fix here. Sometimes it takes some time for the body to heal, but really trusting and having faith in that process.
Absolutely. And then we go back to exactly what you and I were talking about is you go home with that ear infection, you get rest, feed them well, right? Eat your great foods, and that's their bodies will heal. And I'll tell you that they're probably going to heal a lot better with some fruits and vegetables than they are with toast or waffles and crackers. So there's a lot more nutrition in that, right?
Right. Our bodies need the proper nutrients to heal properly. So that makes perfect sense.
Absolutely.
So I know another big thing that you're a proponent for is really educating parents about how important it is for kids to be outside, be active. Tell us more about that.
So, it's a process. So we've seen a lot of so first of all, activity for kids is essential. That's what kids are supposed to do. That's what adults are supposed to do too, but kids are supposed to play. And so, but we also want them to learn. So we have this balance in their lives of schedules of school, of sitting there. And now we throw on their electronics and we're losing that movement part. And the movement is important for everything. It's important for the function of their gut. It's important for their focus. It's important for overall their well-being. Having said that, what we really are seeing a lot more in trends too is the lack of this physical activity. And we're seeing so much, and this is really a big passion of mine, is we're seeing so much chronic disease because of the lack of this physical activity. And then that also goes into the lack of proper nutrition. And so things that I've seen in my time is where we used to see things like type 2 diabetes, about age, 20s and 30s at the earliest, more so like 40s and 50s. We're now seeing it in 5-year-olds and 10-year-olds, which just tells me that we really need to highly focus on their nutrition and the physical activity. So kids should be getting movement every day. I'm going to make a comment on that about what's going on today, which is, most of us are in our homes, and we're trying to take care of our kids at home for the time being. It may be this week, next week. We kind of probably all of us have assumed that it's going to be 2 weeks. How much longer, we don't know. And what I would say is still work with your kids to get that physical activity, put that into their schedule. And if it's, I don't know about you, Dr. Laura, but for me, it's raining outside here. There's definitely things that they can do in the rain, but otherwise make that time to take them outdoors, get outside, get them moving. It's a part of their overall well-being. As I said, it's part of their physical well-being to prevent any chronic disease. But it's a very important part of their emotional well-being, also part of their growth. It's part of all their skills.
Yes, it is. And, my son goes to a preschool where they go outside every single day, rain, snow, hot weather. It does not matter what the weather is. It's all about wearing appropriate outerwear. So it's interesting. I really appreciate that. It doesn't matter if it is cold or rainy outside. He's outside, he's splashing in the puddles. It's like his favorite thing to do.
That's awesome.
Yeah. And that is really important for his health and vitality. And I do, he's still going outside every day, even, though he's not at school anymore.
Dr. Laura, I have a big smile on my face right now because that is such great advice. I'm going to back up what I said and say, go outside no matter what. That's fantastic. And you know what? They get such that sensory input that they get just by being out there with the rain and touching it and feeling it and playing with it. That's amazing. And you're absolutely right about the cold. These kids, I'd be freezing and kids are out there having so much fun. So I'm going to back it up and say exactly what you said.
Yeah, you just make sure they're wearing their appropriate layers, but that's all they need. They do. And it is really fun to witness, right? Like just watching how kids will just have so much joy in being outside and really connecting to nature, right? How healing that is for us as well.
It's fantastic. That's what they need. You just said that, connecting to nature. And during this time period, I would suggest to families to really make a decision on what you want for screen time, because that's not connecting. And that is absolutely okay, especially when you guys are all inside and really need that time for yourselves. You're like, look, I'm just going to put them on the TV for 30 minutes. I get that. I do. But there has to be some balance. It's not going to be 2 weeks of our kids turning into Disney Plus. Is it too late?
I don't know. Yeah, it's true. And I would say that is probably a big challenge for a lot of parents right now, including myself, because it's just so easy to just pop on the TV, right? And get that, just like, but it's can you talk about screen time and how detrimental this is for kids?
It's detrimental. And so I'll start with the first part, which is it's not helpful for them when they're younger. So it's really hard when you have an 18-month-old and some other 18-month-old is sitting there like doing their ABCs on an iPad. And you're like, wow, well, my kid doesn't know how to do that. It's okay. They will learn how to do it when it's time for them to learn how to do it, and they won't do it on an iPad. But it's so you're not losing anything by not having it. The negatives of having it are enormous. From I'll focus on the biggest part. The biggest part is that when they're on it, they don't live in the real world. And so they are constantly getting these little rewards, whether it's adults who are getting likes or kids who are in video games or kids even on their little YouTube. They get a little something that they like. And these are hits. They're getting quick dopamine hits all day long on the screen. It's a little thing that pops up, whatever it is. And that creates changes in their brains. And those changes in their brains aren't exactly helpful in the real world. So what we see is that then they go into the real world and they can't wait for 5 minutes to get their water at the restaurant, or they have to get things right away. So there's a lot of literature too there's literature on sugar and also video games on addiction, on neural changes. And so we do look at it and really feel like, look, we want to live in the real world, right? Like in the real world, in today's 2020, kids have screens. So the best thing is to limit the screen time to what's reasonable. I would say it depends. I would have said Monday through Friday, try not to have any at all. And then Saturday and Sunday, keep it to half an hour. But absolutely understandable right now if you say, look, I can't do that. I'm just not going to make it. If that's the case, then figure out what's reasonable and stick to that, right? Maybe it's an hour in the morning, an hour in the evening. Maybe some of the moms need to get a workout in and that's what they want to do. I get that. But let's not have 1 hour turn into 4 hours, turn into 8 hours. And then you've gone through 2 weeks and your kids haven't learned how to cook or sew or do any chores or laundry. And instead they are again sucked. How are we going to pull them out of that? Right?
Yeah. And it's, I do see it in my 2-year-old, like how addictive. I mean, that is really the correct word. It's addictive with that dopamine response. Like it's like a drug.
Total drug. It is 100% a drug. And when you take it away, 100%, 100 times out of 100, they will melt down. Right? You just have to expect it. It's like 1 more minute, 2 more minutes, 3 more minutes. It's always at the end of that 1, 3, 6 minutes, they're going to end up melting down. And you just have to get through it. You just go, okay, time's off, dinger, ding. Let's go. Let's move on. We can't have a meltdown because they're having a meltdown, because we should have expected that.
Right. Yeah, it is expected. And, I think this is also really important. I want to mention for parents to be aware of their screen time, right? Like it's very addictive to want to check your news app every 5 seconds and be like, well, what's going on with the coronavirus? But is that really helpful?
No, it's not helpful. In fact, right now, again, what I have been treating again is our kids are fine. Medically, our kids are doing great, but I have been treating a lot of emotional wellness right now with families just to help them get through this. And it's not healthy. I tell them, just, go in your house, stay in your house, close the doors, turn the TV off. It is important, to get a quick check at the end of the day, and there's a lot of people are working, you have work to do, of course, but it is nice to take breaks off of the screen for adults.
Yeah. And I feel like right now is really such a beautiful opportunity to maybe unplug even more than you typically do. And that ideally is allowing a deeper connection within your family.
I think that's 100%. Like, take this as an opportunity. I forgot, someone told me that, I forget his name. He's some actor and he was like in like a wellness retreat by himself for like a week or two, and he just came out of it like yesterday.
Oh, interesting.
I'm like, Well, what an awful time to come out of it. Like, he was just like, I had no idea anything was going on. And what it tells me is that, yes, of course, check your Yahoo News or whatever in the world people are checking. Check it morning, night, check it, but checking it every 5 minutes is not helpful. To turn your notifications off.
Mm-hmm.
Your kids are right in front of you. They're the ones that we have the phone for, just in case my kid needs something. Well, they're right there. So take it as an opportunity to do the things that we really should be unplugged for, right?
Right. And, I know that people are like feeling that disconnect of the social distancing, but at least with our loved ones within our own family, there's an opportunity to really connect, quite deeply. And, whether it's playing board games or, card games or whatever it is. I have the game Monkey Around that I play with my 2-year-old, and he loves it. So it's like, this is such a beautiful opportunity, an unprecedented opportunity where people, cannot be overscheduled. It's like actually impossible to be overscheduled right now, right? Because everything's canceled. So you can have a full calendar, and you have to just literally connect with your loved ones at home.
I love that, because it really, really is. And, by no means are we making light of what's going on outside, but that doesn't mean that has to cause anxiety for people 24/7. Just unplug, be with your kids. They're so lovely. You guys created them. They're lovely, right? We created these little guys, and it's just take the opportunity. Like you said, Dr. Laura, take the opportunity to be with them, interact. One of the best things we can give them is the back and forth, the engagement, interaction. So for those neural connections. And I love the way you said it too, is like, we're, socially distancing, but we can be socially engaged. So we can be even more engaged now than we ever were before.
Yeah, I completely agree with that. And, for me, it also means like, well, my mom is in quarantine in her assisted living care, but we can do video chat, and I have been doing weekly with her, but now we can do it more often. We can FaceTime with cousins. So there's a way to use technology to connect with these loved ones that we can't physically be, in person with.
Haven't you found that you've connected more with people that you maybe hadn't before, the people that are like actually really important in your life? I know for me, my son he's FaceTiming his grandparents, and I think that is meaningful use of the screen time. So technology, that's where technology is great, is that. And then of course, for those of us that are going to get to use online teaching for the next online school, I think there are ways that the screen is helpful. And when I ask people to minimize, I'm talking about the mindless, just the video games, there's a place for it, watching movies, things like that. But that's not what I'm talking, what I'm talking about now for the right connecting is like the FaceTime with, childhood friends and family. And that's lovely. I've found a lot more people that are doing that right now over the last, couple weeks or week. And that's been really nice.
It is. And I think it also allows us to be really clear about who is important in our lives and who do we want to make an effort to connect with, right? Because we don't have this crazy busy schedule to distract us. We get to really be clear about what our priorities are. And that's, I think, so beautiful. And also just, I feel like there's going to be such a rebirth that's going to be coming out at a global level because people are going inward, to come out.
Right. Definitely. It's a challenge, but here's the deal. We're strong. We're all strong. Your listeners are parents. They're warriors. They've done a lot more. They've given birth, right? And we're warriors. We're strong. It's time. It's just a reset. It's a definite reset to reprioritize. And I'm 100% certain we're all going to come out of this amazing. And I'd like to come out of it even more amazing than from before,
And I feel like that's just inevitable because if you think about life in general, whenever we've gone through hard, challenging, difficult times in the past, it was just such an opportunity for growth and expansion.
Agree. And our kids are the same. The kids are the same. They're resilient. Kids are just, they're resilient. They're resilient, and in areas that they're not, this will help them. This is the thing that will help them have, a 2-year-old is very different, but our teenagers and our older kids who've gotten just about everything they've ever wanted, this is really a good opportunity to let them, I shouldn't laugh about this, but like to let them have the one toilet paper roll last a week, get through it. They're going to be just fine.
Yeah, they are. I think that is such a good reminder for parents to hear, because I have talked to parents that are very worried about their children's emotional state, right? And I think we want to shelter our children from pain and discomfort, but the reality is that the experience is actually needed for them to grow. And when we interfere with that process, we're actually doing them a disservice.
100%. It's important for them. Like, our kids are, like I said, they're resilient by nature. But if there's one thing that I could say about all of our kids, is that learning some of that resilience is probably what they need the most in this life, that everything in this world, that they get everything. It's so funny though, because my son, I check in on him. He's 15 and I'm like, how you doing? Good. He's doing great. I go, okay, so here's the deal. I'm going to be a little tired for the next couple of weeks, so I need you to help me out. Like, if I'm a little tired, can you make me some food? Can you put your laundry away? I'm just going to need you to help me out. I'm glad you're good. So, but I'm going to kind of joke around, but in our household, it's sort of like, how can we all help each other?
Yeah. How can we all help each other? I feel like there's that with this connection, there's this team like mentality of like, hey, we're in this together. And what do we need? What is, different family members are going to have different needs, and communicating those needs is so important.
I had a mom text me, one of my patients, and she texted me a couple days ago while, everything's just starting to be uncertain. And she sent me a text and she said, I just want you to know that if you guys need anything in the office, I volunteer.
Oh, wow.
I'm like, is that the sweetest thing? There's so much like goodness that comes out of, people's ability to just do the right thing.
Yeah, that's right.
It's deep, right? right.
I think it's beautiful. I think I am seeing like a lot of that of people, like, how can I help? How can I serve? How can I contribute? At such a large level. My son's preschool was like, well, we were going to go visit, the nursing home, but now, if your kids want to draw a picture, you can mail it to the residents to brighten their day. So it's like finding other ways to connect, right? That may not be an in-person visit, but still sharing hope and positivity and love.
That's really sweet. That's really sweet from the 2-year-olds. And they're like, okay, don't open the packages for 6 hours, okay?
God only knows that they coughed and sneezed all over it, right?
I'm like, what's this? Oh, it looks like spit. That's awesome, though. That's awesome. And I don't know, it's a really good time to reflect on it and just be able to make positive changes in our own households. And by no means, and I'm going to make another comment though. It's okay if people, it's not only okay, it's actually pretty normal if people have a little bit of anxiety or fear. And, it's like we were talking about with the active, and just, spray it. It'll help the viruses, it'll help the bacteria, but it also will help your emotional well-being. And so we need to do what we need to do. We need to wash our hands. We need to keep clean. And then we need to teach that to our kids. but then there's so much more that we're going to be able to do over the next couple weeks.
Yeah, I think every action step that helps us feel empowered is really important right now, because, if you read the news, it can feel actually quite disempowering. And so it's really just like, well, what can I do to keep me and my family safe and healthy, and, what we need.
Yeah, it's definitely a good idea to sometimes just turn off that television, because it's not, there's so many non-facts out there. I'll just have to say that there's so many things that are not facts that are out there. And, I don't, like, for example, I don't post that often, but lately I've been putting some posts so people can really get an idea of what I'm seeing, which is nothing. And so, the whole world's not seeing nothing. We're clearly seeing things, but I want them to know that their kids are okay. And, cause I take care of kids. And so, and I'm seeing a lot of emotional, just not well-being, and we'll get there. So, it's okay if it is okay. I've told moms too, like, you know what, if it just feels good to cry, just cry. You might feel better afterwards.
Yeah.
You might feel better afterwards, because you know what, you just, 4 days ago you were with your friends and going out to dinner and going to spin and yoga, and now you're not really sure what's going on, but you're inside. And how that just basically, we shook everybody's worlds. But and it's okay to cry, but then remember that you've got this, because you're a mama and you're a warrior.
Yeah. Yeah, I really am so glad that you said that, because I think it is important to that it is normal to feel this anxiety, right? And it's also, and it's okay to process. It's important to process it, actually. When we try to keep a stiff upper lip, we don't want to, let's say, cry in front of our children. I think we're really doing a disservice, because it's important for them to recognize, yes, it is stressful right now, and it is normal to cry when we're stressed out. And then we also can rebound and recover from that,
I think it's totally okay to cry in front of the kids. They are already in tune with our emotions, and it's nice to share it with them.
Yeah,
it really is. And age appropriate. So age appropriate, you can say, what, mama's just a little bit tired, or mama's scared, or and it's okay. That doesn't make them scared. They know everything's fine. Everything's going to be all right, but I just needed to get it out, and I'm tired and I'm tense. It's okay. Mama didn't get to go out with her friends tonight.
Yeah.
I'm having wine with you. Whatever it is. But, so I think that I'll definitely say we're going to be all right. We're already all right. We'll get through this, and it'll just keep us stronger.
Yeah, there's no doubt we're going to all come out stronger at the other side of this. So,
absolutely.
Yeah, thank you. So, do you have, I know you had shared that you wanted to share a promotion with our listeners so that they could also check out the active product.
Absolutely. If there's any left, we have a code. It's Well-Adjusted Mama is the code. And it's a 20% discount code for active. And I would encourage you to stock up on it, because it's just lovely. I have it just, personally, I have it in every room, in my car, at work, and we are spraying it on. My husband and my son love it when I just spray it on their face.
I know, I've used it on my son as well, and it's really great for any types of cuts, scrapes, and any type of abrasions. The website's what is the website?
So it's let me see where it's at. It should be buildactive.com. BLDGACTIVE.com. Buildactive.com. Can I just make a comment, though? Is that, so if we're going to talk about that, it is the one thing you need. It is the one product, because travel in your purse, like you said, and we just because of the things that are going on right now, I don't think we spent that much time talking about it. I really did want it. I wanted to talk with you about matters that are really relevant right now. It's really hard to talk about much else other than our world pandemic, but the active is the one product you need. It's it. It works as, instead of any antibiotic ointment. It helps heal for cuts. It will diaper rashes. Just spray that on. To keeping viruses and bacteria off, spray that. So it is like that one. The way I've described it is like, did you ever watch that big fat Greek wedding where they Windex everything's Windex?
Yes.
And I'm just like active on everything for us, for me. And I mean, we used to, my son's 15, and when I had a diaper bag, I felt like I used to carry around like a suitcase. And now moms are like in their, fanny pack or their messenger bag. And it's just the one item you need. You take it and there's a little rash, spray it. If there's, you want to use it as, to keep the hands clean, spray it. For killing viruses, killing bacteria, everything. So it's that one all-purpose. It's just the one thing you need, and definitely travel with it. And I do believe it's available right now.
Yeah. And I think it's also important because like the labels are like one's for baby, one's for kids. It's the same product. So I've used it on myself as well and my husband. So it's like, it is all purpose, universal, easy, right? We don't need universal products. And one other thing, there's not all the toxic ingredients
that's natural
we're finding in some of these other skincare products, right? So that's why it's also really valuable.
Well, especially, right. I mean, and that, yes, absolutely. It's natural. It's a naturally occurring molecule. It's not toxic. But what we're seeing right now is keep doing what people are doing with their with alcohol, and their hands are going to be just gone in the next 3-4 days. So you really got to balance that with an active just actually heals the damage done.
Yeah.
Right? It's healing the damage that I'm doing when I'm at work, just scrubbing, and then the active's actually healing it.
Right. That's awesome.
Yeah.
Well, Dr. Shakha, thank you so much for coming on and sharing your hope and your positivity and your inspiration and your wisdom.
Thank you for having me. And to all the parents, you guys, we got this.